Hi, I'm Dr. Kelly Starrett, physical therapist and co-founder of The Ready State, and I want to just welcome you to our surgery protocol for people who maybe before surgery or around surgery, maybe it's you or someone you know or an athlete you're working with. And our intentions with this protocol are to help sort of illuminate some of the aspects of behavior and some of the tactical things that we can do to have a more successful surgical outcome. Oftentimes we just think, hey, I'm going to roll in here and then have surgery and then step one, surgery, step three, world championship. And there's a few more steps in there. One of the things that's unique about our protocol is that we're taking the same principles, the same lessons, the same sort of perspective that we have around human performance and applying it backwards towards this situation, which is sort of sometimes out of our control. It means we're going to talk about psychology and goal setting. We're going to talk about nutrition and sleep and how to appropriately manage sort of this complex psycho-emotional human in this time where the sometimes loci of control has been taken away. We have a saying around here that you either can heal at the rate of a human being or you heal slower than that. And clearly that may be different for different people in different cohorts, but we're either going to max out the rate of your own personal healing or we're going to heal slower than that. So there's no such thing as a fast healer, but there is certainly a lot that we can do that we traditionally don't do to improve how we react and how we manage from this post-surgical stress, post-surgical insult. So again, one of the things you'll see is that we're going to kind of talk about goal setting. We're going to talk about some of the complex psycho-emotional components that you may not think about or being on your radar. We're going to talk tactically about optimizing sleep and things that you can do to decongest and help along the health of the tissues, as well as how do I think about returning to sport and returning to activity. The goal here is that sometimes surgery is unavoidable. And if we keep in mind that there's a ton of things that we can do besides show up for the day and have the surgery, you're going to see that a lot more of this is in your control. And theoretically, you can have outcomes that far exceed what the current medical establishment believes is possible. So welcome to the surgery protocol. We're going to explain and share all the things that we've learned in the past nearly 2 decades of working with people who are about to have the same experience you have.